Welcome, everybody. I am so excited to introduce you to our guest today, Tamyra Trice, and she is the medical director at Progressive Community Health Centers. And she's here to talk to us about the vaccine and give us some more information about its importance, some history behind it, some role models that are available for folks. And before we get started, can you tell us about yourself?
Sure. My name again is Tamyra. I'm currently, as you said, the medical director at Progressive Community Health Centers, which is a federally qualified healthcare center right here in Milwaukee's inner city, near West Side. Really, we have a few locations right on 35th and Lisbon, and also at my location where I see patients in the Hillside community on 7th and Cherry. We also serve patients with an urgent care at the Aurora Sinai facility on 12th and Kilbourne. I see patients, family practice, so from babies all the way up to seniors. I'm born and raised in Milwaukee. I went to school locally here as well as my college at Marquette University. I'm an alum there. And I've been working in community health since I got out of school. It's been going on 15 years now, so it's been quite a while. And I enjoy working in the community from which I was born and raised and served, and I'm happy to give back to our community.
I muted myself again.
Oh, okay.
So yes, that is a great story, and we so appreciate it. And I know every Marquette person that watches this will be up and dancing. Awesome. And so one of the reasons we did connect was you wrote an op-ed in the Journal Sentinel on May 14th, and it was titled, "I am a physician assistant in Milwaukee. We must work to educate Wisconsinites on the importance of being vaccinated." Can you give us a little summary of what you wrote and why you wrote your opinion, and just share some more?
Sure. I was approached actually by my national profession academy. They, as you know, with dealing with COVID, which is such a huge life-changing event that we went through last year and still going through now, quite frankly, the push was obviously to get a vaccine so that we can stop the transmission, or at least slow down and stop the transmission of the virus, and to prevent others from getting it, and to prevent death ultimately. So I was approached because being a healthcare provider of color, it would be beneficial to hear from people of color, to hear from professionals in healthcare that are of color. So, and also understanding that there was going to be some hesitancy as it relates to the vaccine and safety and just questions in general. So I was just approached just to talk about it, because sometimes these things are not the easiest things to talk about. And I felt fine. I felt fine dealing with it. So I took the opportunity, and I kind of, did some research myself, of course, read through some things that was going on. And I wrote the article mainly just the first part is to be an example, to show, I'm sorry, those are my dogs.
That's what I love about this event. It's life, right?
The first part is just to say, hey, I got the vaccine. And that's usually the main thing that my patients want to know too, is like, did you get it? And that's the very first thing I felt like I had to open up the article with saying is, yes, I got it. Yes, I'm fine. Yes, I trust it. I believe it in it. And that was the premise, kind of the introduction, and to also understand that, as I opened up, I work at a community health center. So the majority of our patients at Progressive are people of color. So we affect the community directly. And just to know that, that is so important to build that kind of relationship and that kind of rapport, because sometimes people may not go into a doctor's office, but they might see you, or, they might read something, and that's so important. So I felt like that was important to just say that, but then also to address the fact that there is a reluctancy in general with people of color as it relates to healthcare industry. Like a lot of people don't necessarily trust in like medications. They don't trust and necessarily want to take a vaccine. So just opening up and just giving some credibility to the fact that, you know, this has been vetted. This is, although, you know, we were in emergency use period, but this has been studied. It's been shown to be safe. And at the time I wrote this article, it was well before now. Now we're in July, right? So we have even more data. We have even more time, and we have even more. We can see at this time we weren't seeing as much as we're seeing now, how the numbers have dropped down. You know, how the deaths have dropped down, how the city has opened, how the state is open, and things like that. So it has been proven to be effective even up until now. So I had to just give some credibility to the vaccine, to address the reluctancy that we had issues in the history of our country as it relates to African Americans, specifically in the healthcare system. A lot of people know about Tuskegee, but there's been several other incidents that have happened, and there's a sense of distrust. So just to acknowledge that is, I feel like, was very important, but to also acknowledge the fact that, the vaccine is really here for all people, and it's for everybody to have a part of it to save lives. And that was the main reason that I wrote about it. I hope that answered the question.
Oh, yeah, definitely answered it. And what a great opportunity that you were called upon to share your thoughts and express the importance of the vaccine from your professional organization. That's such a nice honor.
Yeah. And that's AAPA, by the way, the American Academy of Physician Assistants.
APA. Okay, cool. And then the other thing I was going to say too, which I think we did not talk about, but it's or in our little prep is you're talking about vaccine now. It seems to me the research, 2 points. One is that people can help provide evidence by signing up, correct? So you can be part of a question answer type of thing app. So that's one way to help validate what the vaccine is doing and how it's working. And
right.
Then, yeah, go ahead.
I was going to say, yeah, that's the Be Safe. And I actually participated in that when I received Pfizer. I received Pfizer Biotech in January, and my second one in February. And I was part of Be Safe, which was really an easy way to report anything that was happening with me, if anything happened, which it did. For me, it didn't. I had a pretty good experience besides having a sore arm and maybe just a little bit of fatigue, but I really couldn't tell because I'm usually tired on the weekends. So, so I didn't know, but they checked on me. So it was like every day, after the vaccine, then it goes every 2 weeks. And then I think monthly for a while. So just to make sure that we're reporting if we're having any issues, but then they also have the, if you do have a adverse reaction, as healthcare providers, we are obligated, mandated to report any side effects that occur if we give the vaccine and a patient experiencing an adverse reaction. So it's ongoing, it's an ongoing effect. It's going to continue to be ongoing with it being a new vaccine.
That technology, the technology we have is so amazing. And one reason, obviously, that vaccine came out so quick. The other point I was going to make too is what I'm hearing, and I think you'll agree, is that folks that are getting sick now are the ones that did not get the vaccine. So that we do need to just keep making sure people try to get in and become safer.
Yeah, it seems that the highest percentage of patients that are getting the virus at this point are unvaccinated, and that would make sense because they don't have any immunity against the virus, and those who receive the vaccine do, and that's and that's the whole point of us wanting to do it, right? Is to figure out a way where we can prevent ourselves from being sick, or if we do because it's not 100% effective. And that's what people say, well, why do I get the vaccine if I can still get it? That's some people's rationale is like, I'm not going to get it because I can get it anyway if I don't get it. So I should just don't get it. But I'm like, but I have to explain. It's like, no, you significantly reduce your chances of actually getting it when you are fully vaccinated. And then if you were to still be that small percentage of people that still contracted, the disease is minimal. I mean, it's not as aggressive, it's not as bad, and you still are protected against death and hospitalization significantly being fully vaccinated. And I try to paint that picture as clear as I can so that people can make an informed decision.
Thanks. That's important. Thank you for sharing that, because not everyone's really quite aware of what that vaccine does for us. And you did touch upon a bit of the skepticism related to African Americans, folks of Black and brown color, being skeptical of the healthcare system. For folks that don't know about that, I know I've learned a few new things. Can you touch upon some of what those hot buttons are that folks don't know why healthcare is avoided by some people?
So in the Tuskegee experiment and with syphilis and with African-American men specifically, and how that was allowed to the stage to study the various stages of syphilis purposely when they had a cure and a treatment to prevent it from going into those third and fourth stages. And withholding that information, and that was the most, I feel like that's the most, and that's kind of what people struggle with today, is like the fact that historically the medical system withhold it in this particular, and that's not even the whole medical system. This is just a situation, but specifically withholding information, treatment that was permanently harmful to individuals, and that is wrong, And once, a lot of times once you kind of break the trust of a community, of even of a person, relationship to relationship, it's very difficult to rebuild back. Not impossible, but difficult. But in order to rebuild back, you have to acknowledge the situation, acknowledge what happened, and acknowledge that was wrong. And also invest in a way that you can say, this is how we will protect you from future occurrences, and be true to the word. And I think that that's what really needs to happen in the African-American community. I mean, there's been other situations, as it relates to gynecology, in the African-American community, and how women were treated. So, and you also just generationally, those things get passed down, because if it happened to like my grandmother or my great grandmother, she's going to pass it down to her daughters and her daughters' daughters to never trust, you know what I mean? So this is generational too. So we have it. So it's going to have to start with rebuilding and being true with information. And like I said, the most detrimental part I felt like was withholding the information that was harmful to families. So, yeah, and for those reasons, and those are only a few, the other thing is like, how, I'll bring up one more, how it's been studied, how people of color may be treated differently with the healthcare system as it relates to pain, how if me and you went to the hospital, I'm a Black woman, you're a white woman, and if we go for the same situation, the same symptoms, the same time frame, that I would not be treated in a way where my pain would be considered to be real and yours would be, and we might get two totally different outcomes, and that is still occurring as well. And those are just a few reasons, and valid reasons, why there's mistrust. So it's an uphill battle, I feel, but it's not, like I said, it's not impossible, but we have to, as a community together, of all people, of a healthcare community and the community in general, to be fair and to talk about these issues, but also to talk about and to be truthful about solutions on how we're going to make sure things like this never happen again in our country.
Agreed. And almost a segue there is, in your article, you did cite a scientist, African-American woman
Yes, ma'am.
that was part of the team that did develop one of the vaccines. And you yourself are becoming um, a simple model for the community here in Milwaukee. Are there any other colleagues or folks that you think are important to cite and give hope to the community at large on how to advance science as a person of color, but also just embrace it?
Yes. I think that any, doctor, and who you were speaking of is Dr. Kazmikia Corbett. She's a researcher who was instrumental in developing the Moderna vaccine. And I think that is important for people of color just to see that it's not the paternalistic white male doctor that is doing everything in this situation, that people from all sorts of backgrounds, colors, ethnicities, and age generations have been instrumental in COVID, in treating and also developing vaccinations and treatments in general. And even in our Milwaukee community, there's various providers and people of color that are working in healthcare. I was thinking about this question, and I can throw out some names. So I don't want anybody to get offended if I don't say your name. But just speaking of FQHCs, Milwaukee Health Services is another community health center, right? And Dr. Carla Wright, she's been working in that community for many, many years. There's the Izzards, Tito and Kevin Izzard. I work with Kevin Izzard, right? He used to work with me at Hillside. He was actually one of my mentors. Dr. Eugene Pruitt, who's been working with the medical college for many, many years. You have different specialists like Dr. Karen Watson, she's gynecology. You have Renee Robinson Settle Robinson, she's a podiatrist. So there's various and many, many more. I don't want to forget anybody. Some of I have another black PA, Dr. Jackie Edwards. She is awesome. So it's a lot of different people in the community that and anybody, no matter where you are, where you touch people, you're going to be an example, and so for anybody that provides healthcare in our community, for all of our community health centers, so we have Progressive Milwaukee Health Services and 16 street clinics. Those are our main community outreach as well, Outreach Healthcare Center, East Capitol. So anybody that are definitely working in those community health centers are touching our community and touching the lives and trying to put a dent in this pandemic. But anybody really who is seeing patients are role models as pharmacists, like Bernard, he's been down at the Locust, MOK, Walgreens for many years. Yeah, for many years. So, anybody that is touching our patients are role models for us, for sure.
And I will say we have Dr. Abiola Keller, who's
Okay.
On faculty at Marquette, and she is a Marquette.
Oh, yes.
So,
I haven't met her, but yes, I've done some things down there.
So she's part of the Near West Side Partner team, as it may be through Marquette.
Okay.
I am actually working with her on a grant. So this is kind of my shout out to Abiola, and she's educating nurses. So, I mean, there's, again, like you're saying, there's so many wonderful, intelligent folks out there that are really supporting the community in many different ways. And
yes,
there's opportunity for our young people to be able to continue to rise.
Yes, continue to rise. It only takes one we need more. By all means, we need more, because as far as PAs in our state, we're in the single digits as, African American. Yeah. So when you talk about percentage wise, so we need more. We have people, and it only takes one to start inspiration, but we need more. So I encourage all my high schoolers, my middle schoolers, even those in college, if you're interested in medicine, you can do it. And there's so many different ways that you can. I'm sorry, this filters.
Yeah, and agreed. So thank you for that. So we will wrap up with this final note, and we did talk about this in the beginning, is tell us how you're encouraging your patients to get vaccinated. And again, we know why it's important, but where do you start with that conversation?
Um, the first thing how I start off with my patients is that I first let them know that I've taken the vaccine. So I tell them I'm never going to ask them to do something that I'm not willing to do myself. And I think that being an example is the foremost, most powerful thing that you can do. And then secondly, I really start the conversation on what reservations or what questions they have, because this is all so new and I don't expect people to have the answers. They're not reading medical journals and stats and, experiments. They want to know what is real, what are the facts, and talk to me in simple ways. So I just first ask about what questions they have, and then we run off, talking about safety, talking about exactly what it does do, what it does not do. And then I just and then I let them know about access. Access is everything. They have to be able to receive the vaccine. So initially it was limited, but now it's everywhere. We at Progressive Community Health Centers give vaccine walk-in Wednesday through Friday every week at our Lisbon Avenue location on 35th and Lisbon. But I know all of my partners out here in community health are offering the vaccinations as well. I know that my partners with the systems are also with like Frederick and Aurora and Ascension are offering as well as our pharmacies and health departments. So there are ample opportunities and resources and access. I tell them it doesn't matter which vaccine you choose, just choose one. And I'll talk about the differences between the three that we have available for us. So I'm that's my approach. And I say, well, even if you're just thinking about it, think about it, but come back and talk to me about it again. And we just keep talking about it. I say, it's not going anywhere. COVID is still here and the vaccine is still here too. And it'll be available to you whenever you're ready for it. But I don't want you to wait too long. So that's kind of how I communicate with my patients.
Perfect. Yeah. Well, I appreciate your time. You are on just really an inspiration for us at many, many levels. And we appreciate the fact that you are willing to promote this vaccine, promote a healthy community, and be part of the solution. Thank you.
You're welcome. Thank you for having me, and thank you for this opportunity. Just to help the initiative. It's going to take all of us in this together.
It is. So agreed. Thank you.
Welcome.